Question 1. Process analysis reveals that an animal control officer has responded to a report of a severely underweight dog with visible ribs and lethargy, confined to a small, unsanitary outdoor enclosure with no access to fresh water. The officer observes the dog shivering and exhibiting signs of distress. What is the most appropriate immediate course of action to address the consequences of potential neglect and abuse, ensuring compliance with Australian animal welfare legislation? Option A. Focus on gathering witness statements from neighbors before approaching the property or the animal to build a stronger case for neglect. Option B. Immediately seize the animal, arrange for urgent veterinary assessment, and thoroughly document the scene and the animal's condition, including photographic evidence. Option C. Advise the owner that the animal appears underweight and instruct them to provide food and water, returning in 24 hours to check on the situation. Option D. Contact a local veterinarian to discuss the case and await their advice before taking any action regarding the animal's removal or the property. The correct answer is B. Immediately seize the animal, arrange for urgent veterinary assessment, and thoroughly document the scene and the animal's condition, including photographic evidence. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an animal control officer to balance immediate intervention with the need for thorough evidence gathering. The officer must act decisively to protect the animal from further harm, while also ensuring that any subsequent legal action is robust and defensible. The emotional distress of the animal and the potential for public scrutiny add further layers of complexity. The officer's judgment is critical in determining the appropriate level of intervention and the subsequent reporting procedures, all within the bounds of the relevant Australian legislation governing animal welfare. Correct approach analysis. The correct approach prioritizes the immediate safety and welfare of the animal, which is a fundamental duty under Australian animal welfare legislation, such as the Prevention of Cruelty to Animals Act (POCTA) in Victoria or equivalent state-based legislation. This involves securing the animal and arranging for veterinary assessment to document injuries and suffering. Simultaneously, it mandates thorough documentation of the scene and any evidence of neglect or abuse. This comprehensive approach ensures that the animal receives necessary care and that a strong case can be built if prosecution is warranted, adhering to the principles of evidence-based decision-making and the legal requirements for proving cruelty or neglect. Incorrect approaches analysis. One incorrect approach would be to solely focus on removing the animal without adequate documentation. This fails to meet the evidential requirements for potential prosecution, making it difficult to hold the perpetrator accountable under the law. It also neglects the crucial step of obtaining veterinary evidence, which is often vital in establishing the extent of suffering and the link to neglect or abuse. Another incorrect approach would be to delay intervention to gather more evidence, potentially allowing the animal's condition to worsen. This directly contravenes the duty of care and the legislative imperative to prevent suffering. Animal welfare laws are designed to facilitate prompt action when an animal is at risk. A third incorrect approach would be to rely on anecdotal evidence or assumptions without objective observation and documentation. While community concerns are important, animal control officers must base their actions and reports on factual, observable evidence to ensure fairness and legal validity. This approach risks making unsubstantiated claims, which would be inadmissible in legal proceedings, and could undermine the credibility of the officer and the agency. Professional reasoning. Animal control officers should employ a systematic approach. First, assess the immediate risk to the animal's welfare. If risk is present, prioritize intervention to mitigate harm. Second, meticulously document all observations, including the animal's condition, the environment, and any statements made. Third, secure the animal and arrange for immediate veterinary assessment. Fourth, follow established agency protocols for reporting and evidence handling. Finally, consult with supervisors or legal counsel when complex cases arise, ensuring all actions align with legislative requirements and ethical best practices. Question 2. The audit findings indicate that an animal control officer responded to multiple calls involving distressed animals across a local government area. One call involved a suspected injured kangaroo, another a stray dog exhibiting aggressive behavior, and a third a group of feral cats in a residential area. The officer has limited transport cages available and must decide on the most effective and humane approach for capturing and transporting these animals, considering the varying needs and potential risks associated with each situation. Which of the following approaches best demonstrates adherence to regulatory requirements and best practice in animal control? Option A. Capture the injured kangaroo using appropriate netting and a stretcher if necessary, ensuring minimal stress, and providing immediate basic first aid if possible before transport in a secure, ventilated cage. Subsequently, capture the aggressive dog using a catch pole and a muzzle, transporting it in a separate, secure, ventilated cage. Address the feral cats using humane traps, transporting them in appropriately sized, ventilated carriers. Option B. Attempt to capture the injured kangaroo first using the most robust available restraint, then secure the aggressive dog with a catch pole and transport them both in the same, partially secured vehicle, before addressing the feral cats with whatever equipment remains. Option C. Prioritize capturing the feral cats first using nets and then transport them in a single, large, ventilated crate, followed by the kangaroo using a blanket to restrain it and the dog using a slip lead, transporting them in separate, smaller cages. Option D. Focus on capturing the aggressive dog first using a quick and forceful method to subdue it. Then capture the feral cats using any available nets, and finally attempt to capture the injured kangaroo using a basic snare, transporting all animals together in the available cages to save time. The correct answer is C. Prioritize capturing the feral cats first using nets, and then transport them in a single, large, ventilated crate, followed by the kangaroo using a blanket to restrain it and the dog using a slip lead, transporting them in separate, smaller cages. Explanation. Scenario analysis. This scenario presents a common challenge for animal control officers where conflicting priorities and resource limitations necessitate a strategic approach to animal capture and transport. The need to address multiple animal welfare concerns simultaneously, while adhering to strict legislative requirements and ensuring the safety of both the public and the animals, demands careful judgment and a thorough understanding of best practices. The officer must balance immediate intervention with the long-term welfare implications of the chosen capture and transport methods. Correct approach analysis. The correct approach prioritizes the welfare of the most vulnerable animals and employs methods that minimize stress and injury during capture and transport, aligning with the principles of humane animal handling and the requirements of relevant Australian animal welfare legislation. This includes selecting appropriate equipment based on the species and condition of the animal, ensuring secure and ventilated transport, and adhering to established protocols for animal restraint and movement. This approach reflects a commitment to both legislative compliance and ethical animal care. Incorrect approaches analysis. One incorrect approach involves prioritizing the speed of capture over the welfare of the animals, potentially leading to the use of inappropriate or overly forceful methods that could cause distress or injury. This fails to meet the ethical standards of animal welfare and may contravene specific provisions within animal control legislation that mandate humane treatment. Another incorrect approach might be to use generic capture equipment without considering the specific species, size, or temperament of the animals, increasing the risk of escape, injury, or undue stress. This demonstrates a lack of professional diligence and a failure to apply knowledge of species-specific handling techniques, which is a cornerstone of effective and ethical animal control. A further incorrect approach could be to transport animals in unsecured or inadequately ventilated containers, exposing them to environmental extremes or the risk of escape. This directly violates animal welfare standards and could lead to legal repercussions under animal cruelty provisions. Professional reasoning. Professionals should adopt a decision-making process that begins with a thorough assessment of the situation, including the species, number, condition, and behavior of the animals, as well as the surrounding environment and potential risks. This assessment should then inform the selection of the most appropriate capture and transport techniques, prioritizing animal welfare, safety, and legislative compliance. Continuous professional development in animal handling and knowledge of current best practices and relevant legislation are crucial for making sound judgments in such scenarios. Question 3. Cost-benefit analysis shows that investing in understanding the underlying behavioral drivers of an animal's actions, rather than solely focusing on immediate containment or removal, leads to more sustainable community safety and improved animal welfare outcomes. A local council has received multiple complaints about a dog exhibiting persistent barking and digging in its yard, causing distress to neighbors. The council's animal control officer is tasked with resolving the situation. Which of the following approaches best reflects best professional practice in this scenario, considering the importance of ethology? Option A. Advise the owner to implement stricter confinement measures, such as a larger fence and increased leash use when outside, without investigating the reasons for the barking and digging. Option B. Recommend immediate euthanasia of the dog due to the persistent nature of the complaints and the potential for escalation. Option C. Rely on neighbor reports to determine the dog's temperament and recommend immediate impoundment based on the perceived nuisance. Option D. Conduct a thorough ethological assessment of the dog to understand the triggers for its barking and digging, and then work with the owner to develop a behavior modification plan tailored to the dog's specific needs and motivations. Correct answer is B. Recommend immediate euthanasia of the dog due to the persistent nature of the complaints and the potential for escalation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an animal control officer to balance immediate public safety concerns with the long-term welfare and behavioral needs of an animal. The officer must interpret complex animal behavior, understand the implications of different management strategies, and make a decision that is both legally compliant and ethically sound, all within a potentially time-sensitive situation. The challenge lies in moving beyond a simplistic problem animal, labeled to a nuanced understanding of the animal's motivations and the potential for behavioral modification. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing an ethological assessment. This aligns with the principles of responsible animal management and the ethical obligations inherent in the Certificate Roman IV in Animal Control Framework, which implicitly or explicitly requires officers to consider animal welfare and behavior. Understanding the dog's ethology, its natural behaviors, motivations, and the context of its actions is crucial for determining the root cause of the perceived nuisance or threat. This allows for the development of targeted interventions that address the underlying behavioral issues rather than just suppressing symptoms. Such an approach is more likely to lead to a sustainable resolution, reducing the likelihood of recurrence and promoting the animal's well-being, which is a core tenet of animal control legislation and ethical guidelines. Incorrect approach is analysis. An approach that immediately recommends euthanasia or permanent removal without a behavioral assessment fails to consider the animal's welfare and the potential for rehabilitation. This is a regulatory and ethical failure, as it bypasses the requirement to explore less drastic measures and assumes the animal is inherently dangerous or unmanageable without evidence. It prioritizes immediate, albeit potentially disproportionate, resolution over a thorough, welfare-conscious investigation. An approach that focuses solely on immediate containment or restraint without investigating the behavioral triggers is also problematic. While containment might be necessary for safety, it does not address the underlying ethological reasons for the behavior. This can lead to ongoing stress for the animal and a failure to resolve the issue in the long term, potentially resulting in repeated complaints and a cycle of reactive interventions. This approach neglects the proactive and preventative aspects of animal control. An approach that relies on anecdotal evidence or public perception without a professional assessment of the animal's behavior is a significant ethical and potentially regulatory failure. Public opinion can be influenced by fear or misinformation, and an animal control officer's duty is to make objective, evidence-based decisions. Failing to conduct a proper ethological assessment means the decision is not grounded in professional expertise, leading to potentially unjust outcomes for the animal and an ineffective resolution for the community. Professional reasoning. Professionals should employ a decision-making framework that begins with information gathering, including understanding the reported behavior and its context. This is followed by an assessment phase, which in this case necessitates an ethological evaluation to understand the animal's motivations and behavioral patterns. Based on this assessment, a range of intervention strategies should be considered, prioritizing those that are least invasive and most likely to achieve a positive, long-term outcome for both the animal and the community. This process should always be guided by relevant legislation, ethical codes, and a commitment to animal welfare. Question 4. Quality control measures reveal that a domestic dog presented to an animal control officer is exhibiting lethargy, a decreased appetite, and has developed a persistent cough. The officer notes the dog is otherwise alert and responsive. Considering the common health issues in domestic animals, which of the following approaches best reflects the animal control officer's professional responsibilities and scope of practice? Option A. Suggest the owner administer over-the-counter human cold medication to alleviate the dog's symptoms while observing for improvement. Option B. Immediately recommend a full diagnostic workup at a veterinary clinic, including blood tests and X-rays, due to the potential for serious respiratory illness. Option C. Conduct a thorough visual and physical assessment. Consider the presenting signs in the context of common canine ailments, and advise the owner on the necessity of seeking veterinary attention for a definitive diagnosis and treatment plan. Option D. Advise the owner on supportive care measures for a mild cold and monitor the situation, as these symptoms can be indicative of common viral infections that often resolve on their own. The correct answer is D. Advise the owner on supportive care measures for a mild cold and monitor the situation, as these symptoms can be indicative of common viral infections that often resolve on their own. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an animal control officer to differentiate between common, treatable health issues and more serious, potentially contagious conditions that necessitate immediate veterinary intervention and public health considerations. Misidentification can lead to delayed treatment, animal suffering, and potential spread of disease, impacting both animal welfare and community safety. The officer must apply knowledge of common domestic animal ailments, understand the limitations of their role, and know when to escalate to a veterinarian. Correct approach analysis. The correct approach involves a systematic assessment of the animal's presenting signs, considering the most probable common health issues based on species, age, and observed symptoms. This approach aligns with the Certificate Roman IV in Animal Control curriculum's emphasis on recognizing common animal health problems and understanding the scope of practice for animal control officers. It prioritizes the animal's welfare by seeking appropriate care promptly, while also adhering to regulatory requirements for reporting and managing potential public health risks. This demonstrates best professional practice by acting within the officer's competency and ensuring the animal receives the correct level of care. Incorrect approaches analysis. One incorrect approach involves assuming all observed symptoms are minor and can be managed with basic care without further professional assessment. This fails to acknowledge the potential for serious underlying conditions, contravening the ethical obligation to ensure animal welfare and potentially violating animal cruelty provisions if suffering is prolonged due to neglect. It also overlooks the regulatory requirement to report or seek veterinary advice for conditions that could pose a public health risk. Another incorrect approach is to immediately assume the most severe possible diagnosis without a thorough initial assessment. Caution is important. An overreaction without evidence can lead to unnecessary distress for the animal and owner and potentially misallocate resources. This approach may not align with the principle of providing proportionate and evidence-based care, and could lead to unnecessary veterinary costs or interventions. A third incorrect approach is to dismiss symptoms as normal aging or breed-specific traits without considering the possibility of treatable illness. This can lead to a failure to identify and address conditions that, while perhaps common in older animals or certain breeds, are still amenable to treatment and can significantly improve the animal's quality of life. This approach neglects the duty of care and the pursuit of optimal animal health outcomes. Professional reasoning. When faced with an animal exhibiting health concerns, an animal control officer should follow a decision-making process that begins with a visual and physical assessment to gather objective data. This includes observing the animal's demeanor, mobility, respiration, and any visible abnormalities. The officer should then consider the animal's history, if available, and compare the observed signs to their knowledge of common domestic animal health issues relevant to the species. Based on this assessment, the officer must determine if the condition falls within their scope of practice for initial management or if it necessitates referral to a veterinarian. This involves understanding the signs that indicate a need for professional veterinary diagnosis and treatment, such as severe pain, lethargy, difficulty breathing, or suspected contagious diseases. The officer's role is to identify potential problems, ensure immediate safety and welfare, and facilitate appropriate care, not to provide veterinary diagnosis or treatment. Question 5. The audit findings indicate that a local animal shelter, managed by an accredited animal control officer, has been deviating from established vaccination protocols for newly acquired animals. The officer has been relying on a mix of personal experience and informal advice from other shelter staff regarding the timing and types of vaccinations administered. The audit specifically questions the adherence to the recommended core vaccination schedules for dogs and cats as outlined in national veterinary guidelines and state-specific animal health directives. Which of the following actions by the animal control officer would best address the audit findings and ensure compliance with Australian regulatory requirements and best practice in animal welfare? Option A. Immediately cease all vaccinations until a comprehensive review of all animal health records and current veterinary literature can be completed, prioritizing the most critical vaccinations based on perceived immediate risk. Option B. Continue with the current practice but document all informal advice received and the officer's rationale for each vaccination decision, assuming that individual professional judgment supersedes formal guidelines in specific circumstances. Option C. Request a meeting with the shelter's veterinarian to discuss the audit findings and propose a simplified, generalized vaccination protocol that is easier for shelter staff to administer consistently, focusing on common diseases. Option D. Implement a revised vaccination schedule that strictly adheres to the latest Australian veterinary guidelines for companion animals and the relevant state or territory legislation, ensuring all newly acquired animals receive vaccinations according to these updated protocols. The correct answer is A. Immediately cease all vaccinations until a comprehensive review of all animal health records and current veterinary literature can be completed, prioritizing the most critical vaccinations based on perceived immediate risk. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the animal control officer to interpret and apply complex vaccination protocols within a specific regulatory framework, balancing animal welfare with public health requirements. Misinterpreting or failing to adhere to these protocols can have significant consequences, including the spread of preventable diseases, legal repercussions for the facility, and potential harm to animals. The officer must demonstrate a thorough understanding of the relevant legislation and guidelines to make informed decisions. Correct approach analysis. The correct approach involves consulting the most current Australian veterinary guidelines and the relevant state or territory legislation pertaining to animal management and disease prevention. This ensures that the vaccination schedule implemented is legally compliant, scientifically sound, and aligned with best practices for animal health and public safety. Adhering to these established protocols demonstrates a commitment to professional responsibility and ethical animal care, minimizing the risk of disease transmission and ensuring the well-being of the animals under the facility's care. Incorrect approaches analysis. Implementing a vaccination schedule based solely on anecdotal evidence or the recommendations of a single veterinarian without cross-referencing official guidelines is a regulatory failure. It risks non-compliance with legal requirements and may not reflect the most up-to-date scientific understanding of disease prevention. This approach prioritizes convenience or personal opinion over established standards, potentially compromising animal health. Adopting a one-size-fits-all vaccination approach for all animals, regardless of species, age, or individual health status, is an ethical and regulatory failure. It ignores the specific needs of different animals and the varying risks associated with different diseases. This can lead to undervaccination in some animals and unnecessary vaccination in others, both of which are detrimental to animal welfare and public health. Relying on outdated vaccination schedules or guidelines from previous years is a significant regulatory and ethical failure. Disease patterns and vaccination recommendations evolve with scientific research. Using outdated information can leave animals vulnerable to preventable diseases and may not meet current legal obligations for disease control. Professional reasoning. When faced with discrepancies or uncertainties regarding vaccination protocols, animal control professionals should adopt a systematic approach. First, identify the specific species and age group of the animals in question. Second, consult the primary regulatory documents, such as state/territory animal control acts and associated regulations, and the most recent Australian veterinary guidelines for companion animals and livestock. Third, if ambiguity persists, Seek clarification from a veterinarian with expertise in public health or animal infectious diseases, ensuring any advice received is consistent with the overarching regulatory framework. Document all decisions and the rationale behind them. Question 6. The performance metrics show a consistent delay in the finalization of incident reports, with officers frequently submitting summaries rather than detailed accounts. Considering the regulatory framework for animal control in Australia, which of the following reporting practices best aligns with the requirements for effective incident management and legal compliance? Option A. Relying on verbal briefings to supervisors regarding significant incidents and only documenting minor matters in writing. Option B. Compiling a brief summary of key events for each incident and submitting these at the end of the week to consolidate administrative tasks. Option C. Completing detailed reports only when an investigation is nearing completion or a prosecution is being considered. Option D. Prioritizing the immediate recording of all legally mandated details for each incident, including observations, actions taken, and evidence collected, using a standardized reporting template and submitting these reports promptly. The correct answer is D. Prioritizing the immediate recording of all legally mandated details for each incident, including observations, actions taken, and evidence collected, using a standardized reporting template and submitting these reports promptly. Explanation. This scenario is professionally challenging because it requires an animal control officer to balance the immediate need for accurate and timely reporting with the potential for information overload and the risk of omitting critical details. The officer must understand the specific requirements of the relevant Australian legislation, likely the Prevention of Cruelty to Animals Act or equivalent state legislation, and associated local council bylaws, which mandate detailed record-keeping for animal welfare incidents. The challenge lies in capturing all legally required information without compromising the efficiency of subsequent investigations or creating an unmanageable administrative burden. The correct approach represents best professional practice because it prioritizes the systematic collection and accurate recording of all legally mandated information at the earliest opportunity. This aligns with the principles of good governance and accountability within animal control services. By ensuring all required fields are completed accurately and promptly, the officer is fulfilling their statutory obligations, providing a clear and defensible record of events, and facilitating effective follow-up actions, such as prosecution or welfare interventions. This approach minimizes the risk of legal challenges due to incomplete or inaccurate documentation and upholds the integrity of the animal welfare system. An incorrect approach that involves summarizing information without capturing all legally required details fails to meet the statutory reporting obligations. This could lead to a situation where crucial evidence is not documented, potentially jeopardizing any subsequent legal proceedings or welfare assessments. Ethically, it demonstrates a lack of diligence and respect for the legal framework governing animal welfare. Another incorrect approach, such as delaying the completion of reports until the end of a shift or week, introduces a significant risk of memory fade and the omission of vital details. This compromises the accuracy and reliability of the documentation, which is a direct contravention of the principles of good record-keeping and may violate specific legislative requirements for timely reporting. It also hinders the ability of supervisors or other officers to act swiftly on the information. A further incorrect approach, which involves relying solely on verbal reporting without creating a written record, is fundamentally flawed. Most animal control legislation requires written reports for incidents. Verbal reports are ephemeral and lack the evidentiary weight and permanence necessary for legal and administrative purposes. This approach creates a significant gap in accountability and transparency. Professionals should employ a decision-making framework that prioritizes understanding the specific reporting requirements of the relevant Australian legislation and local bylaws. This involves developing a systematic process for data collection in the field, utilizing standardized reporting templates, and allocating dedicated time for accurate and complete documentation immediately after an incident or at the earliest practical opportunity. Regular review of reporting procedures and ongoing professional development in record-keeping best practices are also crucial. Question 7. Compliance review shows that an animal control officer responded to a call regarding a distressed, potentially injured dog wandering near a busy road. The dog appeared disoriented and was exhibiting signs of fear. The officer has the necessary equipment to safely contain the animal. What is the most appropriate course of action for the animal control officer in this situation? Option A. Leave the animal in a safe, secluded spot off the road and return later to check on its condition, as it appears to be a domestic animal and not an immediate threat. Option B. Release the animal back into the vicinity where it was found, assuming it is a local stray and will find its own way. Option C. Attempt to locate the owner by knocking on nearby doors, as the dog may have simply wandered off from a nearby residence. Option D. Safely contain the animal using appropriate equipment and transport it to a designated animal holding facility or veterinary clinic for assessment and care, while initiating procedures to identify its owner. Correct answer is D. Safely contain the animal using appropriate equipment and transport it to a designated animal holding facility or veterinary clinic for assessment and care, while initiating procedures to identify its owner. Explanation. This scenario presents a professional challenge due to the conflicting demands of animal welfare, public safety, and the legal obligations of an animal control officer. The officer must balance the immediate needs of a distressed animal with the potential risks it poses to the community and the established procedures for handling such situations. Careful judgment is required to ensure that actions are both humane and legally compliant. Adhering strictly to the Certificate Roman IV in animal control curriculums focus on responsible and lawful animal management. The correct approach prioritizes the immediate safety of the public and the animal, while also initiating the legally mandated process for assessing and managing the animal's welfare. This involves securing the animal in a safe and appropriate manner, contacting the relevant authorities, such as a veterinarian or animal shelter, for further assessment and care, and documenting all actions taken. This aligns with best professional practice by upholding the duty of care to the animal, fulfilling the responsibility to protect the community, and operating within the legal framework governing animal control. Specifically, it reflects the principles of responsible animal management and the legal requirements for dealing with stray or potentially dangerous animals as outlined in Australian animal control legislation. An incorrect approach that involves immediately releasing the animal without proper assessment or containment would be a significant regulatory and ethical failure. This action disregards the potential for the animal to be diseased, injured, or aggressive, thereby endangering public safety and failing to fulfill the officer's duty to manage animal-related risks. It also bypasses the necessary steps to identify the animal's owner or to ensure it receives appropriate care, which is a core function of animal control. Another incorrect approach, such as impounding the animal without attempting to assess its immediate welfare needs or seeking veterinary advice for a visibly distressed animal, could also be problematic. While impoundment is a necessary step, failing to address immediate suffering or potential medical emergencies before or during the impoundment process could be seen as a breach of the duty of care towards the animal. This might contravene specific guidelines on animal welfare within the regulatory framework. A further incorrect approach, such as leaving the animal unattended in a public area due to perceived lack of resources or time, would be a direct failure to manage the animal and a potential breach of public safety regulations. This demonstrates a lack of proactive problem solving and a failure to adhere to the core responsibilities of an animal control officer. The professional decision-making process for similar situations should involve a rapid assessment of the immediate risks to public safety and animal welfare. The officer should then consult their training and the relevant legislation to determine the most appropriate course of action. This typically involves securing the animal, contacting appropriate support services, and meticulously documenting all steps taken. Prioritizing humane treatment, public safety, and legal compliance are paramount. Question 8. Stakeholder feedback indicates that animal control officers sometimes struggle to differentiate between normal animal behavior and early signs of pain or discomfort, particularly in less obvious cases. When encountering a dog that is panting heavily and appears restless in a warm environment, which of the following approaches best demonstrates the professional recognition of potential pain and discomfort, adhering to Australian animal welfare principles? Option A. Focus solely on whether the dog is showing aggression or fear, and if not, assume it is not in significant pain or discomfort, as these are the most obvious signs. Option B. conclude that the dog is likely just hot and excited, and monitor it from a distance without immediate intervention, as panting and restlessness can be normal responses to warmth and activity. Option C. Immediately assume the dog is experiencing heat stress and requires cooling measures and veterinary assessment, as panting and restlessness are significant indicators of distress in this context. Option D. Wait for the dog to exhibit more severe symptoms, such as collapse or vomiting, before considering it to be in significant pain or discomfort, as milder signs can be ambiguous. The correct answer is C. Immediately assume the dog is experiencing heat stress and requires cooling measures and veterinary assessment, as panting and restlessness are significant indicators of distress in this context. Explanation: this scenario is professionally challenging because it requires the animal control officer to make a rapid, informed judgment about an animal's welfare based on subtle behavioral cues, often under stressful or time-limited circumstances. The officer must balance the need for intervention with the potential for misinterpretation, which could lead to unnecessary distress for the animal or a missed opportunity to provide critical care. The regulatory framework for Certificate Roman IV in animal control in Australia emphasizes the responsible and humane treatment of animals, requiring officers to recognize and respond appropriately to signs of distress. The correct approach represents best professional practice because it prioritizes direct observation and a systematic assessment of the animal's behavior and physical condition. This aligns with the principles of animal welfare legislation in Australia, such as the Prevention of Cruelty to Animals Act, POCTA, in Victoria, or equivalent legislation in other states, which mandate that persons in charge of animals must take reasonable steps to alleviate suffering. By considering multiple indicators of pain and discomfort, the officer is employing a comprehensive diagnostic approach, minimizing the risk of misdiagnosis and ensuring that any intervention is justified and appropriate. This methodical approach is ethically sound and legally defensible. An incorrect approach that relies solely on a single, easily observable sign, such as vocalization, is professionally unacceptable. While vocalization can indicate pain, it can also signify other states like excitement or fear, leading to a potential misinterpretation. This could result in unnecessary intervention or, conversely, a failure to recognize genuine distress, which would be a breach of the officer's duty of care under animal welfare laws. Another incorrect approach that involves assuming the animal is not in pain because it is not exhibiting obvious signs of aggression or fear is also professionally flawed. Many animals, particularly those in chronic pain or experiencing internal discomfort, may become withdrawn or lethargic rather than overtly distressed. This approach demonstrates a lack of understanding of the diverse ways pain can manifest and could lead to a failure to identify an animal in need of assistance, contravening the spirit and letter of animal welfare legislation. A third incorrect approach that involves deferring judgment until a veterinarian is present without any initial assessment is also problematic. While veterinary consultation is crucial for diagnosis and treatment, the animal control officer has a primary responsibility to conduct an initial assessment to determine if immediate intervention or reporting is necessary. Delaying any assessment could exacerbate the animal's suffering. The professional decision-making process for similar situations should involve a multifaceted approach. 1. Initial observation. Conduct a thorough visual and auditory assessment of the animal from a safe distance. 2. Behavioral assessment. Note posture, movement, vocalizations, facial expressions, and interactions with the environment. 3. Physical assessment if safe and appropriate. Observe for signs like limping, guarding a body part, changes in breathing or discharge. 4. Contextual analysis. Consider the animal's environment, recent history, and potential stressors. 5. Prioritization. Determine the urgency of the situation based on the observed signs and potential for suffering. 6. Action. Implement appropriate actions which may include reporting to a veterinarian, providing immediate first aid if trained and authorized, or safely containing the animal for further assessment. 7. Documentation. Record all observations and actions taken. Question 9. The assessment process reveals a dog exhibiting a dull, brittle coat, poor muscle tone, and a general lack of energy. The dog's living environment appears clean, but the owner states they are feeding the dog a diet primarily consisting of table scraps, based on the Certificate Roman IV in Animal Control Regulatory Framework. Which of the following actions best demonstrates the recognition of potential nutritional deficiencies and adherence to animal welfare obligations? Option A. Immediately administer deworming medication and advise the owner on parasite control measures. Option B. Focus solely on the cleanliness of the environment and conclude that the animal's welfare is adequate. Option C. Advise the owner that the dog's condition is likely due to age and that no further action is required. Option D. Document the observed physical signs and environmental conditions and recommend a veterinary consultation to assess for nutritional deficiencies and overall health. The correct answer is A. Immediately administer deworming medication and advise the owner on parasite control measures. Explanation. Scenario analysis. This scenario is professionally challenging because recognizing subtle signs of nutritional deficiencies in animals requires a combination of observational skills, knowledge of animal physiology, and an understanding of relevant legislation. Animal control officers often encounter animals in varying states of health and welfare, and distinguishing between a general illness and a specific nutritional issue can be difficult without a systematic approach. The urgency of animal welfare dictates prompt and accurate assessment to prevent further suffering or irreversible health damage. Correct approach analysis. The correct approach involves a comprehensive assessment that considers the animal's physical condition, behavior, and environment, cross-referenced with known signs of common nutritional deficiencies as outlined in animal welfare legislation and industry best practices for animal care. This aligns with the duty of care mandated by animal welfare laws, which require individuals responsible for animals to provide adequate nutrition. By systematically observing and documenting these signs, an animal control officer can build a strong case for intervention, ensuring the animal receives appropriate veterinary care and that the owner is educated or held accountable for providing adequate sustenance. This approach prioritizes the animal's immediate welfare and long-term health, adhering to the principles of responsible animal management. Incorrect approach is analysis. One incorrect approach is to immediately assume a parasitic infestation or infectious disease without considering nutritional factors. This fails to meet the legislative requirement to assess all potential causes of ill health, including inadequate diet. It can lead to misdiagnosis, delayed treatment, and unnecessary expenditure of resources on treatments that may not address the root cause. Another incorrect approach is to dismiss subtle physical changes, such as dull coat or lethargy, as normal aging or minor issues. This overlooks the critical role of nutrition in maintaining animal health and can result in the progression of deficiencies to more severe stages, potentially violating animal welfare standards that require prompt attention to signs of distress or ill health. Finally, relying solely on owner statements without independent observation and assessment is a significant failure. Legislation typically places the onus on the animal control officer to conduct an objective assessment, and accepting an owner's word without verification can mask underlying neglect or ignorance regarding nutritional needs. Professional reasoning. When faced with an animal exhibiting potential signs of nutritional deficiency, an animal control officer should employ a structured decision-making process. This begins with a thorough visual and physical examination, noting any abnormalities in coat condition, body condition score, muscle mass, energy levels, and any unusual behaviors. This observation should be followed by an assessment of the animal's living environment, including the availability and type of food and water. The officer must then consult their knowledge base and relevant regulatory guidelines regarding common nutritional deficiencies and their observable signs. If suspicion of a deficiency arises, the next step is to document all findings meticulously and, if necessary, consult with a veterinarian for a definitive diagnosis and treatment plan. This systematic approach ensures that all relevant factors are considered, leading to appropriate intervention and compliance with animal welfare legislation. Question 10. System analysis indicates that an animal control officer is responding to a report of a dog with a visible limp and a matted coat. Upon arrival, the officer observes the limp and notes the dog appears underweight. The owner states the dog has had the limp for a few weeks and admits they haven't had the dog vaccinated or treated for fleas in over a year, citing financial constraints. The officer also notices the dog's water bowl is empty. Considering the Certificate Roman IV in Animal Control Regulatory Framework and best practices for preventative health care, what is the most appropriate initial course of action for the animal control officer? Option A. Advise the owner on the importance of regular veterinary checkups, vaccinations, and parasite control, and offer resources for low-cost veterinary services, while also ensuring the dog has immediate access to water and documenting the observed conditions and the owner's stated reasons for non-compliance. Option B. Seize the animal immediately due to the visible limp, underweight condition, and lack of preventative care, as these indicate a failure to provide for the animal's basic needs. Option C. Issue an immediate warning to the owner for failing to provide adequate preventative health care and leave the premises, assuming the owner will seek veterinary attention due to the warning. Option D. Focus solely on the empty water bowl and instruct the owner to fill it, deferring any discussion about the limp, coat condition, or preventative care until a future visit. Correct answer is A. Advise the owner on the importance of regular veterinary checkups, vaccinations, and parasite control, and offer resources for low-cost veterinary services, while also ensuring the dog has immediate access to water and documenting the observed conditions and the owner's stated reasons for non-compliance. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the immediate needs of an animal with the long-term health and welfare implications, while also considering the owner's capacity and willingness to comply with preventative health measures. Animal control officers often encounter situations where owners may have limited resources or understanding of animal health, necessitating a nuanced approach that prioritizes the animal's well-being within the existing legal and ethical framework. The officer must assess the situation objectively, gather relevant information, and make a decision that is both legally sound and ethically responsible. Correct approach analysis. The correct approach represents best professional practice because it prioritizes the animal's immediate health and safety by seeking veterinary intervention for a visible injury, while also initiating a conversation about preventative health care. This aligns with the core responsibilities of animal control officers under Australian animal welfare legislation, which mandates the prevention of cruelty and suffering. By engaging the owner in a discussion about vaccination and parasite control, the officer is proactively addressing potential future health issues and educating the owner on their responsibilities, thereby promoting responsible pet ownership and reducing the likelihood of future neglect or suffering. This approach is proactive, compassionate, and legally compliant. Incorrect approaches analysis. One incorrect approach involves solely focusing on the immediate injury and issuing a warning without addressing the underlying issues of preventative care. This fails to uphold the broader mandate of animal welfare legislation, which extends beyond immediate harm to encompass the overall health and well-being of the animal. It neglects the opportunity to educate the owner and prevent future suffering, potentially leading to recurring health problems for the animal and further intervention being required. Another incorrect approach would be to immediately seize the animal without a clear and immediate threat to life or severe suffering that cannot be addressed otherwise. While seizure is a power available to animal control officers in certain circumstances, it is typically a last resort. Without a thorough assessment of the owner's capacity and willingness to seek veterinary care for the injury, and without exploring less intrusive options first, immediate seizure could be deemed an overreach and potentially lead to legal challenges. It also bypasses the opportunity for education and rehabilitation of the owner-animal relationship. A third incorrect approach would be to ignore the visible injury and only focus on the owner's lack of preventative care documentation. This prioritizes administrative compliance over the animal's immediate physical suffering. Animal welfare legislation places a primary emphasis on preventing harm and suffering, and overlooking a visible injury in favor of paperwork would be a significant ethical and regulatory failure. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough assessment of the animal's immediate welfare. This involves identifying any signs of injury, illness, or distress. Following this, the officer should gather information from the owner regarding the animal's history, including vaccination and parasite control status. The next step is to evaluate the owner's capacity and willingness to address the animal's needs, both immediate and ongoing. Based on this assessment, the officer should then determine the most appropriate course of action, which may include providing advice, issuing warnings, facilitating veterinary care, or, in severe cases, initiating seizure proceedings. Throughout this process, Maintaining clear, objective documentation and adhering to relevant legislation and ethical guidelines are paramount. Question 11. Comparative studies suggest that effective animal control in urban environments hinges on a proactive and legally compliant approach to managing animal-related nuisances. An animal control officer receives a complaint about a dog that is frequently barking, digging up a neighbor's garden, and occasionally escaping its yard. The complainant is distressed and has requested immediate removal of the animal. The officer has a duty to investigate and respond appropriately. Which of the following approaches best aligns with the regulatory framework for animal control in Australia and promotes a balanced outcome? Option A. Immediately impound the dog based on the complainant's distress and request, as this is the quickest way to resolve the immediate nuisance and ensure public peace. Option B. Recommend to the owner that the dog be euthanized due to its nuisance behaviors, as this is the most permanent solution to prevent future complaints. Option C. Advise the complainant that while the behavior is undesirable, animal control cannot intervene unless there is direct physical harm to a person or significant property destruction, and suggest they resolve the issue directly with the owner. Option D. Conduct a thorough investigation, documenting the specific behaviors, assessing the risks to public safety and property, and consulting relevant state/territory animal welfare legislation and local council bylaws to determine the appropriate course of action, which may include issuing warnings, requiring corrective measures from the owner, or, if necessary, impounding the animal. The correct answer is D. Conduct a thorough investigation, documenting the specific behaviors, assessing the risks to public safety and property, and consulting relevant state/territory animal welfare legislation and local council bylaws to determine the appropriate course of action, which may include issuing warnings, requiring corrective measures from the owner, or, if necessary, impounding the animal. Explanation. This scenario is professionally challenging because it requires an animal control officer to balance immediate public safety concerns with the legal obligations and ethical consideration surrounding animal welfare and property rights. The officer must navigate a complex web of legislation, including local council bylaws, state/territory animal welfare acts, and potentially common law regarding nuisance. The risk assessment approach is crucial here, as it allows for a structured evaluation of potential harms and the appropriate level of intervention. The correct approach represents best professional practice because it prioritizes a thorough, evidence-based risk assessment that directly aligns with the principles of responsible animal management and public safety as mandated by Australian animal control legislation. This involves identifying the specific behaviors of the animal, the potential risks posed to people and other animals, and the property damage occurring. It also necessitates understanding the relevant legal frameworks, such as the Companion Animals Act 1998 NSW, or equivalent state/territory legislation, which often outline procedures for dealing with nuisance animals, including investigation, warnings, and potential impoundment or orders. This approach ensures that actions taken are proportionate, legally defensible, and aimed at achieving a sustainable resolution while upholding animal welfare standards. An incorrect approach that focuses solely on immediate removal without proper investigation or documentation would fail to meet regulatory requirements. For instance, failing to issue a formal warning or gather evidence of the nuisance behavior could be challenged legally, potentially leading to a finding of unlawful seizure or action. This would violate the procedural fairness principles embedded in most Australian legislation. Another incorrect approach, such as ignoring the complaint due to a perceived lack of severity, would be a failure to act under duty of care provisions within animal welfare legislation and local council responsibilities, potentially leading to escalation of the nuisance and increased risk. Ethically, this would also be a dereliction of duty. A third incorrect approach, involving immediate euthanasia without exploring all available legal and welfare-oriented options, would be a severe breach of animal welfare legislation, which mandates that euthanasia is a last resort and only to be performed by authorized personnel under specific circumstances, such as irremediable suffering or extreme danger. The professional decision-making process for similar situations should involve 1. Receiving and documenting the complaint thoroughly. 2. Conducting an initial assessment of the reported behavior and potential risks. 3. Consulting relevant legislation and local bylaws to understand legal obligations and available powers. 4. Undertaking a site visit and evidence gathering, e.g., observing the animal, speaking with the complainant and potentially the owner, documenting damage. 5. Performing a formal risk assessment based on gathered evidence. 6. Communicating with the animal owner, explaining the concerns and legal requirements and exploring potential solutions. 7. Implementing appropriate actions based on the risk assessment and legal framework, which may include warnings, orders, mediation, or, as a last resort, impoundment. 8. Maintaining detailed records of all actions taken and communications. Question 12. Assessment of a situation where an animal control officer observes a group of kangaroos exhibiting agitated behavior, including vocalization and short bursts of chasing, in a suburban park. The officer notes that one kangaroo appears to be repeatedly nudging another, which is not retaliating. Considering the social structures of native Australian wildlife and the relevant legislative framework, what is the most appropriate initial course of action? Option A. Ignore the behavior, as it is likely a natural interaction within the kangaroo social hierarchy and not a matter for animal control intervention. Option B. Observe from a safe distance to determine if the behavior is part of a normal social interaction or indicative of distress or injury, consulting relevant wildlife management guidelines if necessary. Option C. Assume the behavior is aggressive and call for wildlife rescue services to remove all kangaroos from the area. Option D. Immediately attempt to herd all kangaroos away from the park to prevent potential escalation of aggression and ensure public safety. The correct answer is B. Observe from a safe distance to determine if the behavior is part of a normal social interaction or indicative of distress or injury, consulting relevant wildlife management guidelines if necessary. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the animal control officer to interpret complex social behaviors in both domestic and wild animals, and to apply this understanding within the framework of Australian animal welfare legislation and local council bylaws. Misinterpreting social structures can lead to inappropriate interventions, potentially causing distress to animals, public safety risks, or legal noncompliance. The officer must balance the immediate need for intervention with a nuanced understanding of animal behavior and its legal implications. Correct approach analysis. The correct approach involves a thorough assessment of the observed behaviors, considering the species-specific social structures and the immediate context. This aligns with the principles of the Prevention of Cruelty to Animals Act 1979, NSW, or equivalent state legislation, which mandates that animals must be provided with adequate care and protection from suffering. Understanding social dynamics helps determine if the observed interaction is a normal social behavior or indicative of distress, aggression, or a welfare concern requiring intervention. For instance, recognizing a dominance hierarchy in dogs or a territorial dispute in native wildlife allows for a more informed decision on whether to intervene, and if so, how. This approach prioritizes animal welfare and public safety based on evidence and behavioral understanding, adhering to the ethical obligations of an animal control officer. Incorrect approach is analysis. One incorrect approach would be to immediately assume conflict and attempt to separate all animals involved without further observation. This fails to recognize that many animal interactions, particularly within established social groups, are normal and necessary for maintaining social order. Such an intervention could disrupt natural hierarchies, cause undue stress, and potentially escalate aggression as animals react to the forced separation. Ethically, this approach is flawed as it prioritizes a simplistic solution over a welfare-informed assessment. Legally, it could be seen as an unnecessary interference if no actual cruelty or danger is present, potentially contravening the spirit of animal welfare legislation by causing distress. Another incorrect approach would be to dismiss the observed behavior as just animals fighting and take no action, even if the behavior appears unusually aggressive or prolonged. This neglects the duty of care and the potential for serious injury or distress. It fails to consider that unusual behavior might indicate underlying issues such as disease, injury, or extreme stress, which are covered under animal welfare legislation. Ethically, this is a dereliction of duty. Legally, it could lead to breaches of the Prevention of Cruelty to Animals Act if an animal suffers preventable harm due to inaction. A third incorrect approach would be to apply domestic animal socialization principles directly to wild animals. Wild animals have distinct social structures, territorial behaviors, and predator-prey dynamics that differ significantly from domestic animals. Attempting to socialize or interfere with wild animal interactions based on domestic pet behavior could be dangerous to both the officer and the animals, and could disrupt natural ecosystems. This approach is ethically unsound due to the potential for harm and legally problematic, as it demonstrates a lack of understanding of the specific legislative requirements for managing wildlife, which often falls under different regulations and agencies. Professional reasoning. When faced with animal behavior, a professional animal control officer should employ a systematic decision-making process. This begins with observation and data gathering, focusing on the species, context, and specific behaviors. Next, the officer should access and apply their knowledge of species-specific social structures and behaviors. This knowledge should then be cross-referenced with relevant legislation, e.g., Prevention of Cruelty to Animals Act, local council bylaws, and organizational policies. The officer must then assess the level of risk to public safety and animal welfare. Based on this comprehensive assessment, the officer can determine the most appropriate course of action, which may range from no intervention to intervention, reporting, or referral to other authorities. This process ensures that decisions are evidence-based, legally compliant, and ethically sound, prioritizing the welfare of animals and the safety of the community. Question 13. When evaluating the effectiveness of collaboration between animal control services and external veterinary practices and animal shelters in managing animal welfare cases, which of the following approaches best reflects professional best practice and regulatory compliance within the Australian animal control framework? Option A. Assuming that veterinary services and shelters will always have the capacity and willingness to accommodate urgent requests for assessment or intake without prior consultation or established agreements. Option B. Establishing and maintaining clear, documented communication protocols and referral pathways with local veterinary services and shelters, including prearranged contact methods, information sharing requirements, and mutual understanding of service capabilities and limitations. Option C. Providing only minimal, essential information about an animal's condition and the circumstances of its seizure to veterinary services and shelters to maintain confidentiality and streamline the process. Option D. Relying on informal, ad hoc communication methods, such as personal mobile numbers and spontaneous calls, to arrange veterinary assessments or shelter transfers as needed. Correct answer is B. Establishing and maintaining clear, documented communication protocols and referral pathways with local veterinary services and shelters, including prearranged contact methods, information sharing requirements, and mutual understanding of service capabilities and limitations. Explanation. This scenario presents a professional challenge because effective animal welfare outcomes and public safety rely heavily on seamless collaboration between animal control officers and veterinary services/shelters. Animal control officers often encounter situations requiring immediate veterinary assessment or intervention, and shelters are critical for the care and reharming of seized or surrendered animals. Miscommunication or a lack of established protocols can lead to delayed treatment, compromised animal welfare, increased risk to the public, and potential legal ramifications for the animal control agency. The challenge lies in ensuring that all parties understand their roles, responsibilities, and the established communication channels to facilitate efficient and humane outcomes. The correct approach represents best professional practice because it prioritizes the establishment of clear, documented communication channels and collaborative protocols. This ensures that when an animal control officer encounters an animal requiring veterinary attention or needs to transfer an animal to a shelter, the process is efficient, humane, and legally compliant. Adhering to established protocols such as prearranged contact methods, information sharing requirements, e.g., incident details, animal condition, and mutual understanding of service capabilities, directly supports the objectives of animal welfare legislation and the operational efficiency of both animal control and partner services. This proactive approach minimizes delays in critical care, ensures appropriate housing and management of animals, and fosters a strong working relationship built on trust and shared responsibility, which is a cornerstone of effective animal management. An incorrect approach that involves ad hoc communication and reliance on informal arrangements fails to meet professional standards. This can lead to significant delays in obtaining veterinary care for injured or sick animals, potentially exacerbating their suffering and contravening the duty of care mandated by animal welfare legislation. Furthermore, it can result in shelters being unprepared for incoming animals, leading to overcrowding or inadequate resources, which also compromises animal welfare. Ethically, it demonstrates a lack of diligence and commitment to the welfare of the animals under the officer's care. Another incorrect approach, which is to assume veterinary services or shelters will always accommodate requests without prior consultation or understanding of their capacity, is also professionally unsound. This can strain the resources of these vital services, potentially impacting their ability to care for other animals. It also fails to acknowledge the legal and operational frameworks within which veterinary practices and shelters operate, which may include specific intake procedures or capacity limitations. This approach can lead to frustration, breakdown in relationships, and ultimately, poorer outcomes for animals. A further incorrect approach, such as withholding critical information about an animal's condition or the circumstances of its seizure from veterinary services or shelters, is a serious ethical and potentially legal failing. Transparency is crucial for accurate diagnosis, treatment, and appropriate management of animals. Failure to provide complete information can lead to misdiagnosis, inappropriate treatment, or the introduction of disease into a shelter environment, all of which are detrimental to animal welfare and public health. This lack of candor undermines the collaborative effort and can have severe consequences. The professional decision-making process for similar situations should involve a proactive understanding of the established interagency protocols. When encountering a situation requiring collaboration, the animal control officer should first consult their agency's guidelines for contacting and working with veterinary services and shelters. This includes knowing who to contact, what information to provide, and what to expect in terms of response and service. If protocols are unclear or non-existent, the professional should advocate for their development. In the moment, the officer must prioritize the animal's immediate welfare and safety, while also ensuring that their actions align with legal requirements and established best practices for interagency cooperation. This involves clear, concise communication, providing all necessary information, and respecting the roles and limitations of partner organizations. Question 14. The evaluation methodology shows that an animal control officer has responded to a call involving the seizure of multiple animals of various species, including dogs, cats, and a small flock of chickens, from a property where they were allegedly not provided with adequate food. The officer needs to implement an immediate feeding plan for these animals. Which of the following actions best demonstrates adherence to the regulatory framework and best practice for nutrition requirements for these diverse species? Option A. Provide a balanced, species-appropriate diet for each animal group, consulting relevant Australian animal welfare standards and guidelines for specific dietary recommendations based on age and condition. Option B. Prioritize feeding the animals the most palatable food available to encourage them to eat, regardless of specific nutritional content. Option C. Feed all dogs and cats a standard commercial dry kibble and provide the chickens with grain, as these are commonly available and generally accepted foods. Option D. Rely on the previous owner's stated feeding practices, assuming they were adequate, and continue with those methods. The correct answer is A. Provide a balanced, species-appropriate diet for each animal group, consulting relevant Australian animal welfare standards and guidelines for specific dietary recommendations based on age and condition. Explanation. Scenario analysis. This scenario presents a common challenge for animal control officers, balancing the immediate needs of rescued animals with the long-term health implications of inadequate nutrition. The officer must quickly assess the nutritional status of diverse species, each with unique dietary requirements, and implement an appropriate feeding plan under potentially resource-limited conditions. The challenge lies in applying knowledge of species-specific nutrition to a practical, often urgent, situation, while adhering to relevant Australian animal welfare legislation and guidelines. The officer's judgment is critical in preventing further suffering and promoting recovery. Correct approach analysis. The correct approach involves consulting and applying the Australian animal welfare standards and guidelines relevant to the species encountered. This includes understanding the fundamental nutritional needs for each species, such as protein, fat, carbohydrate, vitamin, and mineral requirements, and how these vary with age, health status, and reproductive condition. For instance, a young, growing dog will have different needs than an elderly cat or a bird of prey. The officer must also consider the palatability and digestibility of available food sources, ensuring that the chosen diet is appropriate and unlikely to cause gastrointestinal upset. This approach aligns with the duty of care mandated by animal welfare legislation, which requires providing adequate nutrition to prevent suffering and promote well-being. It demonstrates a commitment to evidence-based practice and responsible animal management. Incorrect approaches analysis. One incorrect approach is to assume all animals of the same species have identical nutritional needs, and to feed them a generic, readily available commercial pet food, without considering individual factors like age, health, or specific dietary sensitivities. This fails to meet the specific requirements of each animal, potentially leading to malnutrition, obesity, or exacerbating existing health conditions, which contravenes the duty of care under animal welfare laws. Another incorrect approach is to prioritize ease of feeding or cost-effectiveness over nutritional adequacy. For example, by feeding only cheap, low-quality food or scraps that lack essential nutrients. This directly violates the requirement to provide adequate nutrition and can cause significant harm, leading to deficiencies and poor health outcomes, which is a breach of animal welfare standards. A third incorrect approach is to rely solely on anecdotal evidence or personal experience without cross-referencing with established nutritional guidelines for the specific species. While experience is valuable, it must be grounded in scientific understanding and regulatory requirements. Failure to do so can result in misinformed decisions that negatively impact animal health, failing to meet the professional standards expected of an animal control officer. Professional reasoning. Animal control officers must adopt a systematic approach when dealing with the nutritional needs of rescued animals. This involves 1. Species identification and assessment of individual animal condition, age, health, reproductive status. 2. Consulting reliable, jurisdiction-specific nutritional guidelines and legislation, e.g., Australian Animal Welfare Standards and Guidelines. 3. Evaluating available food resources for suitability and appropriateness. 4. Implementing a feeding plan that addresses immediate needs while considering long-term health. 5. Monitoring animal response to the diet and making adjustments as necessary. This process ensures that decisions are informed, ethical, and legally compliant, prioritizing the welfare of the animals under their care. Question 15. Quality control measures reveal that during a recent animal apprehension, an officer noted a dog exhibiting rapid, shallow breathing, pale mucous membranes, and a weak, rapid pulse. The dog was otherwise quiet and not overtly aggressive. What is the most appropriate immediate course of action for the animal control officer, considering basic animal anatomy and physiology? Option A. Observe the animal for a further hour to see if its condition improves naturally. Option B. Immediately transport the animal to a veterinary clinic for urgent assessment and treatment. Option C. Continue with standard impoundment procedures, assuming the signs are due to stress from capture. Option D. Administer a mild sedative to calm the animal before transport. The correct answer is B. Immediately transport the animal to a veterinary clinic for urgent assessment and treatment. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires an animal control officer to interpret subtle physiological signs in an animal that could indicate distress or injury, necessitating a prompt and accurate assessment to ensure the animal's welfare and comply with relevant legislation. Misinterpreting these signs could lead to delayed or inappropriate intervention, potentially exacerbating the animal's condition or resulting in a breach of duty of care. The officer must balance the need for immediate action with the requirement for a reasoned, evidence-based decision. Correct approach analysis. The correct approach demonstrates best professional practice by focusing on observable physiological indicators directly related to the animal's immediate well-being. Recognizing that rapid, shallow breathing, pale mucous membranes, and a weak, rapid pulse are classic signs of shock or severe distress aligns with the principles of basic animal physiology and welfare. This approach prioritizes the animal's immediate physiological status, which is paramount in emergency situations, and aligns with the duty of care expected under animal welfare legislation, such as the Prevention of Cruelty to Animals Act, POCTA in Australia, which mandates the provision of adequate care and treatment to prevent suffering. Incorrect approach is analysis. One incorrect approach might involve solely focusing on the animal's behavior, such as appearing lethargic, without considering underlying physiological changes. While lethargy can be a symptom, it is not as specific an indicator of acute physiological compromise as the vital signs. This approach fails to recognize the urgency indicated by physiological distress and could lead to a delay in providing critical care, potentially violating the POCTA by failing to alleviate suffering. Another incorrect approach could be to assume the animal is merely tired or stressed from the capture process, and to proceed with routine impoundment procedures without further assessment. This overlooks the potential for underlying trauma or illness that is manifesting physiologically. Such an approach neglects the responsibility to assess for signs of injury or illness, which is a core function of animal control officers and a legal requirement to prevent cruelty. A further incorrect approach might be to administer medication without veterinary guidance. While the officer may have some basic first aid knowledge, administering pharmaceuticals without a proper diagnosis or prescription from a veterinarian is outside the scope of an animal control officer's authority and could be harmful to the animal, constituting a failure to act within professional boundaries and potentially causing further harm, which is contrary to the principles of responsible animal management and welfare legislation. Professional reasoning. Professionals in animal control should adopt a systematic approach to animal assessment. This involves initial observation of behavior, followed by a more detailed physiological assessment, including vital signs where possible and safe to obtain. If concerning signs are observed, the next step should be to contact a veterinarian or supervisor for guidance, ensuring that any intervention is appropriate and legally sanctioned. This structured approach ensures that decisions are based on objective evidence and prioritizes the animal's welfare in accordance with legislative requirements. Question 16. Upon reviewing a situation where a dog is exhibiting aggressive lunging and barking at a member of the public in a park, and considering the available restraint equipment in your vehicle, which course of action best demonstrates adherence to the principles of animal control and animal welfare legislation relevant to the Certificate Roman IV in Animal Control Qualification? Option A. Apply a heavy-duty muzzle and a strong chain leash simultaneously to ensure complete control. Option B. Immediately deploy a slip lead, ensuring it is snug but not overly tight, while maintaining a safe distance and verbally attempting to calm the animal. Option C. Attempt to physically grab the dog's collar to restrain it without using any additional equipment. Option D. Use a tranquilizer dart to sedate the animal from a distance to prevent any further escalation of aggression. The correct answer is B. Immediately deploy a slip lead, ensuring it is snug but not overly tight, while maintaining a safe distance and verbally attempting to calm the animal. Explanation. This scenario presents a professional challenge because it requires an animal control officer to make an immediate decision regarding the use of restraint equipment on an animal exhibiting aggressive behavior, while balancing the need for public safety, animal welfare, and adherence to regulatory guidelines. The officer must assess the immediate threat posed by the animal, the potential for injury to themselves and others, and the suitability of different restraint tools based on the animal's size, species, and temperament, all within the framework of the Certificate Roman IV in Animal Control curriculum and relevant Australian legislation. The correct approach prioritizes de-escalation and the use of the least restrictive method necessary to safely control the animal. This aligns with the principles of responsible animal management and the legal obligations under Australian animal welfare legislation, which generally mandate that animals be treated humanely and that unnecessary suffering be avoided. Using a method that is appropriate for the animal's size and temperament, and that minimizes stress and potential for injury, demonstrates best professional practice. This approach reflects a thorough risk assessment and a commitment to ethical animal handling. An incorrect approach would involve the immediate and indiscriminate use of the most severe restraint equipment available without adequate assessment. This could lead to unnecessary pain, distress, or injury to the animal, potentially violating animal welfare laws. For example, using a choke chain on an animal that is not exhibiting behaviors that warrant such a device, or using a muzzle that is too tight or not appropriate for the animal's respiratory needs, would be considered a failure to exercise due diligence and could result in regulatory penalties or professional censure. Another incorrect approach would be to fail to use any restraint when the animal poses a clear and present danger, which would be a failure to protect public safety and could lead to legal liability. Professionals should employ a decision-making framework that involves 1. Immediate assessment of the situation and the animal's behavior. 2. Identification of potential risks to public safety and animal welfare. 3. Consideration of available restraint equipment and their suitability for the specific animal and situation. 4. Selection of the least restrictive but most effective method. And 5. Continuous reassessment of the situation and the animal's response to the chosen restraint. This systematic approach ensures that decisions are informed, ethical, and legally compliant. Question 17. During the evaluation of an agitated dog in a confined space, which approach to understanding its body language during handling is most aligned with the principles of humane animal control and officer safety? Option A. Focusing solely on the dog's tail wagging, assuming it indicates friendliness regardless of other behavioral cues. Option B. Assuming the dog will behave predictably based on its breed characteristics without observing its current body language. Option C. Observing the dog's overall posture, ear and tail position, vocalizations, and eye contact, and adjusting handling based on the combination of these signals. Option D. Immediately attempting to restrain the dog firmly if it exhibits any signs of vocalization, without assessing the context or other behavioral indicators. The correct answer is C. Observing the dog's overall posture, ear and tail position, vocalizations, and eye contact, and adjusting handling based on the combination of these signals. Explanation. Scenario analysis. This scenario is professionally challenging because accurately interpreting animal body language during handling is crucial for both the animal's welfare and the handler's safety. Misinterpreting subtle cues can lead to stress, fear, or aggression in the animal, potentially resulting in injury to the animal or the handler. The Certificate Roman IV in Animal Control requires officers to demonstrate competency in safe and humane animal handling, which necessitates a deep understanding of animal behavior. Correct approach analysis. The correct approach involves a systematic observation of multiple body language indicators, considering the context of the situation, and making a judgment based on the overall behavioral pattern. This aligns with the principles of animal welfare and humane treatment mandated by Australian animal control legislation, such as the Prevention of Cruelty to Animals Act (POCTA) in various states, which requires officers to act in the best interests of animal welfare and to prevent suffering. A comprehensive assessment of body language allows for a proactive and responsive handling strategy, minimizing stress and risk. Incorrect approach is analysis. Failing to observe the animal's full body language and focusing only on a single, potentially misleading cue, e.g., a wagging tail, is an ethical and regulatory failure. This approach ignores the complexity of animal communication and can lead to misjudgments, potentially causing distress or harm, which contravenes the duty of care expected under animal welfare legislation. Assuming the animal's behavior is predictable without observing current cues is also a significant failure. This demonstrates a lack of situational awareness and can lead to inappropriate handling techniques, potentially escalating a situation and causing undue stress or injury, violating the requirement for humane handling. Reacting solely to perceived immediate threats without considering the underlying causes of the animal's behavior is another critical failure. This approach is reactive rather than proactive and can escalate fear or aggression, leading to a negative experience for the animal and increased risk for the handler, which is contrary to the principles of responsible animal management. Professional reasoning. Professionals should adopt a holistic approach to assessing animal body language. This involves 1. Observation. Systematically observing the animal's entire body, including posture, tail carriage, ear position, eye contact, vocalizations, and any other relevant physical indicators. 2. Contextualization. Considering the environment, the handler's actions, and any previous interactions with the animal. 3. Interpretation. Synthesizing the observed cues to form an understanding of the animal's emotional state, e.g., fear, stress, curiosity, aggression. 4. Response. Adapting handling techniques and strategies based on the interpretation to ensure safety and welfare. 5. Documentation, recording observations and actions taken, which is often a requirement for reporting and accountability under relevant legislation. Question 18. Process analysis reveals that an animal control officer has responded to a report of a dog appearing underweight and lethargic, housed in a dirty enclosure with limited access to water. The officer observes the dog to be visibly thin, with ribs and spine prominent, and the water bowl is nearly empty and contains murky water. The owner states they have been busy and haven't had much time to attend to the dog. Considering the potential consequences of neglect and abuse under Australian animal welfare legislation, which of the following actions best represents a professional and legally compliant response? Option A. Document all observations thoroughly, attempt to educate the owner on proper care, provide a time frame for improvement, and inform them of the legal consequences of continued neglect, while also reporting the incident to the relevant animal welfare authority for follow-up. Option B. Confront the owner aggressively, demanding an explanation for the dog's condition and threatening immediate impoundment. Option C. Immediately seize the dog, issue a significant fine to the owner, and initiate prosecution without further discussion. Option D. Advise the owner that the dog looks a bit thin but otherwise seems okay, and leave the premises without further action or documentation. The correct answer is C. Immediately seize the dog, issue a significant fine to the owner, and initiate prosecution without further discussion. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an animal control officer to balance immediate intervention with the need for thorough investigation and adherence to legal processes. The officer must assess the severity of the animal's condition, gather evidence of neglect or abuse, and understand the potential legal ramifications for the owner, all while prioritizing the animal's welfare. The complexity arises from distinguishing between accidental oversight and deliberate cruelty, and determining the appropriate course of action under the relevant Australian animal welfare legislation. Correct approach analysis. The correct approach involves a systematic process of observation, evidence gathering, and consultation with relevant authorities. This aligns with the principles of the Prevention of Cruelty to Animals Act (POCTA) in Victoria, Australia, or equivalent state legislation. The officer must document all findings meticulously, including the animal's physical condition, living environment, and any observed behaviors. Engaging with the owner in a professional and non-confrontational manner, while informing them of concerns and potential consequences, is crucial for gathering information and potentially achieving voluntary compliance. If immediate danger is evident, the officer has the authority to seize the animal. Subsequent reporting to the relevant animal welfare body or police ensures the matter is handled through the appropriate legal channels, leading to potential prosecution or rehabilitation orders if warranted. This approach upholds the animal's right to be free from suffering and ensures due process for the owner. Incorrect approach is analysis. One incorrect approach would be to immediately seize the animal and issue severe penalties without a thorough investigation or consultation. This fails to adhere to due process, potentially leading to legal challenges and undermining the officer's credibility. It bypasses the opportunity to educate the owner or achieve voluntary improvement, which is often a more sustainable outcome. This approach risks overstepping the officer's authority and could be seen as an overreaction if the neglect was unintentional or due to lack of knowledge. Another incorrect approach would be to simply issue a warning and leave the animal in the same conditions without further follow-up or documentation. This neglects the officer's duty of care to the animal and fails to address the underlying issues of neglect or abuse. It does not create a record of the incident, making it difficult to pursue further action if the situation deteriorates or if the owner has a history of similar behavior. This approach prioritizes minimal effort over the animal's welfare and legal compliance. A third incorrect approach would be to confront the owner aggressively and make accusations without presenting clear evidence or following established procedures. This can escalate the situation, make the owner defensive, and hinder the investigation. It also deviates from professional conduct expectations and could lead to complaints against the officer. The focus should be on objective assessment and evidence-based action, not emotional confrontation. Professional reasoning. When faced with suspected neglect or abuse, an animal control officer should employ a structured decision-making process. This involves 1. Initial assessment. Observe the animal and its environment for signs of distress, injury, or inadequate care. 2. Evidence gathering. Document all observations with notes, photographs, and potentially witness statements. 3. Legal framework application. Understand the specific provisions of the relevant animal welfare legislation, e.g., POCTA in Victoria, regarding neglect, abuse, and seizure powers. 4. Communication and education. Engage with the owner professionally, explain concerns, and offer guidance or resources if appropriate, while clearly outlining potential consequences. 5. Escalation and reporting. If immediate danger exists or voluntary compliance is not achieved, initiate formal seizure procedures and report the incident to the appropriate authorities for further investigation and legal action. 6. Follow-up. Ensure appropriate follow-up actions are taken to monitor the animal's welfare and the owner's compliance. Question 19. Consider a scenario where you are responding to a call about a stray dog exhibiting agitated behavior in a suburban park. The dog is barking aggressively at passersby and appears cornered near a children's playground. What is the most appropriate initial approach to safely contain the animal? Option A. Attempt to corner the dog using loud noises and rapid movements to disorient it before attempting to grab it. Option B. Approach the dog slowly and calmly, speaking in a reassuring tone, while assessing its body language and the immediate surroundings for potential escape routes or hazards, before deciding on the best containment method. Option C. Wait for the dog to calm down on its own, observing from a safe distance, and only intervene if it directly threatens someone. Option D. Immediately deploy a catch pole to secure the dog from a distance to prevent it from approaching any children. The correct answer is B. Approach the dog slowly and calmly, speaking in a reassuring tone, while assessing its body language and the immediate surroundings for potential escape routes or hazards, before deciding on the best containment method. Explanation. This scenario is professionally challenging because it requires an animal control officer to balance the immediate need to secure a potentially dangerous animal with the ethical and legal obligations to minimize stress and harm to the animal, while also ensuring public safety. The officer must make a rapid assessment of the animal's behavior and the environment, considering various factors that could influence the animal's response to handling. The correct approach represents best professional practice because it prioritizes a calm and controlled environment, uses appropriate personal protective equipment, PPE, and employs a gentle, non-confrontational handling technique. This aligns with the principles of humane animal handling, which are fundamental to the Certificate Roman IV in Animal Control curriculum, and are often reflected in state and territory animal welfare legislation in Australia. Specifically, it minimizes the risk of injury to both the animal and the officer, reduces the animal's fear and stress, and increases the likelihood of successful and safe containment. This approach is consistent with the duty of care owed to the animal and the public. An incorrect approach that involves immediately attempting to physically restrain the animal without prior assessment or calming measures would be professionally unacceptable. This could lead to the animal becoming more agitated, potentially resulting in injury to itself or the officer, and would violate ethical guidelines regarding humane treatment. It could also contravene specific provisions within Australian animal welfare legislation that mandate the prevention of unnecessary pain, suffering, or distress. Another incorrect approach, such as using excessive force or inappropriate equipment, e.g., snare pole in a situation where it is not necessary or could cause harm, would also be a failure. This demonstrates a lack of understanding of animal behavior and safe handling techniques, and could lead to legal repercussions under animal cruelty provisions. A professional decision-making process in such a situation involves a rapid risk assessment, considering the species, size, apparent temperament of the animal, the surrounding environment, and the presence of the public. The officer should then select the least stressful and safest method of capture and restraint, utilizing appropriate equipment and techniques. This process is iterative, requiring the officer to constantly reevaluate the animal's behavior and adjust their approach as needed. Question 20. The review process indicates that an animal control officer responded to a complaint about a dog barking excessively and appearing agitated at the fence line of its property. Upon arrival, the officer observed the dog pacing, panting heavily despite the cool weather, and repeatedly looking away from the officer while maintaining a stiff posture. The dog also emitted low growls when the officer approached the fence. What is the most appropriate initial course of action for the animal control officer? Option A. Conclude that the dog is simply exhibiting normal territorial behavior and leave the property without further action. Option B. Immediately attempt to capture the dog using a catch pole, as its behavior suggests aggression and a potential risk. Option C. Document the observed behaviors, including pacing, panting, stiff posture, avoidance, and growling, and assess the context of the complaint and the environment before deciding on further intervention. Option D. Advise the owner that the dog's behavior is unacceptable and issue a warning for noise disturbance without further investigation of the animal's welfare. The correct answer is B. Immediately attempt to capture the dog using a catch pole, as its behavior suggests aggression and a potential risk. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires an animal control officer to interpret subtle behavioral cues in a potentially distressed animal and make an immediate decision that impacts the animal's welfare and public safety. The officer must balance the need to respond to a complaint with the ethical obligation to avoid causing unnecessary stress or harm to the animal. Misinterpreting the animal's behavior could lead to either an inadequate response to a genuine welfare concern or an overreaction that further distresses the animal. Correct approach analysis. The correct approach involves a systematic observation and assessment of the animal's behavior in its environment, considering the context of the complaint. This aligns with the principles of animal welfare legislation in Australia, which mandates that animals be treated humanely and that their welfare needs be met. Specifically, the Prevention of Cruelty to Animals Act 1979, NSW, and similar state-based legislation require officers to identify and address signs of distress. Observing for a cluster of behaviors such as panting, trembling, vocalization, avoidance, or defensive postures, and considering the duration and intensity of these signs, allows for a more accurate assessment of the animal's stress level. This approach prioritizes the animal's immediate welfare by seeking to understand the cause of distress and intervening appropriately, which may involve further investigation, advice to the owner, or removal of the animal if necessary. Incorrect approach is analysis. One incorrect approach is to immediately assume the animal is aggressive and attempt to capture it without further observation. This fails to recognize that many behaviors indicative of aggression can also be signs of fear or stress. Such an approach could escalate the animal's distress, leading to a defensive reaction that might be misinterpreted as inherent aggression, potentially resulting in unnecessary force being used or the animal being unnecessarily impounded. This contravenes the ethical duty of care and the legislative requirement to act in the best interests of the animal. Another incorrect approach is to dismiss the observed behaviors as normal for the breed or situation without deeper investigation. While some breeds may exhibit certain behaviors more readily, persistent signs of stress, such as excessive panting, trembling, or avoidance, are not merely breed characteristics but indicators of an underlying welfare issue. Ignoring these signs would be a failure to identify and address potential cruelty or neglect, which is a direct breach of animal welfare legislation. A third incorrect approach is to focus solely on the complaint lodged by the neighbor without independently verifying the animal's condition. While complaints are important triggers for investigation, an animal control officer's duty is to assess the animal's welfare objectively. Relying solely on a complainant's interpretation, which may be biased or incomplete, and failing to observe the animal's actual behavioral signs of stress would be a dereliction of professional duty and a failure to uphold animal welfare standards. Professional reasoning. When faced with a situation involving a potentially distressed animal, animal control professionals should employ a structured decision-making process. This involves 1. Initial observation. Safely observe the animal from a distance, noting its posture, vocalization, movement, and interaction with its environment. 2. Contextualization. Consider the circumstances, the complaint, the environment, and any known history of the animal. 3. Behavioral assessment. Identify specific behavioral signs of stress or distress, looking for patterns and intensity rather than isolated incidents. 4. Welfare prioritization. Determine if the observed behaviors indicate a welfare concern that requires intervention. 5. Action planning. Based on the assessment, decide on the most appropriate course of action, which could range from providing advice to the owner, arranging for veterinary assessment, or initiating seizure proceedings, always aiming to minimize further stress to the animal.